Hi, this is Galit Goldfarb. Thank you very much for joining me here today. Today I'm going to be talking about treating irritable bowel syndrome through dietary modifications and supplements. So irritable bowel syndrome, or IBS, is the most prevalent gastrointestinal disorder in the world. It affects about 14% of the global population as of 2019. People with irritable bowel syndrome, also referred to as spastic or nervous colon, suffer from chronic abdominal pain, cramping, bloating, food intolerances, and altered bowel habits such as diarrhea or constipation. People with IBS report having constant diarrhea or constipation, or even both, especially when consuming certain foods that trigger their IBS sensitivities. Now, this greatly reduces a person's quality of life, as you can imagine. The precise cause of irritable bowel syndrome remains unknown. However, alterations in the gut microbiome, the bacteria that we have in our gut, constipation or diarrhea for any reason, along with stress and gut hypersensitivity are likely to play a role. Now, treating IBS can be challenging. With no specific medication developed to cure the disorder, many people focus on treating or minimizing the symptoms. However, there has been much research on treating IBS naturally with change of diet, supplementation, and modification of lifestyle. Now, the first stage is, of course, to examine whether you really have IBS, since its symptoms are not unique. There are other diseases that mimic IBS symptoms, including inflammatory bowel disease, which I made another article and video about, celiac disease, fructose or lactose intolerances, colitis, and more. These must be first excluded by a doctor, taking a careful patient history, physical examination, and some diagnostic testing to evaluate if there is another cause for concern. Symptoms such as unexplained weight loss, unexplained iron deficiency anemia, fever, parasites, a family history of colorectal cancer, celiac disease or inflammatory bowel disease, and onset of the symptoms after the age of 50 may show that there is perhaps a different case for concern. Now, there are diagnostic tests that rule these out. Once IBS is established, therapy begins with education, lifestyle interventions, especially dietary-based, and interventions through medication. Now, here I will cover the diet-based therapy. Number one, first you want to remove food intolerances, if you know that you have them. Approximately 84% of the people suffering from IBS report that their symptoms are triggered by at least one food item. These foods are suspected to cause or aggravate IBS symptoms. These intolerances may be caused by food chemicals in these foods, or increased gut wall permeability, or that certain foods may increase gas volume, causing bloating, pain, and sensitivity due to a mismatch between the gut microbiome that the person has and the foods that they are consuming. Now, the most common food intolerances include gluten, dairy products, coffee, fructose-rich foods, and fried foods. The next step is you want to also shift to a high fiber diet. Fiber is considered a main treatment approach for IBS. Fiber helps with the production of short-chain fatty acids that are a food source for the healthy bacteria in the gut microbiome. Fiber also acts as a bulking agent, improving intestinal transit and decreasing constipation, as well as diarrhea. And soluble fiber is especially helpful and is found in oats, peas, beans, and lentils, apples, citrus fruits, strawberries and other berries, and cooked root vegetables, as well as barley and whole rice, and psyllium. Now, that can be taken as a supplement, and you want to aim for no less than 20 to 30 grams of total dietary fiber, including any supplementary fiber that you take during the day. You also want to eliminate dairy products from the diet. Many people with IBS describe symptoms similar to those of lactose intolerance. Therefore, many people with IBS try to avoid dairy products. In a study, and this is a good thing, in a study led by Just Alguera from the Department of Internal Medicine and Clinical Nutrition at the University of Gothenburg, dairy products were investigated and recognized as a food that provoked symptoms in patients with irritable bowel syndrome. Now, because of the complexity of treating IBS, eliminating the intake of milk, cheese, yogurt, ice cream, whipped cream, sour cream, and all dairy products in general is definitely worthwhile. Also, excessive fermentation of any malabsorbed lactose by the gut bacteria may trigger or exacerbate IBS symptoms. Now, lactose intolerance is caused by a deficiency in lactase, the enzyme that is required to break down lactose. It is commonly found among the general population. Most of the world's population is lactose intolerant or lactase deficient after a certain age, after the weaning age. And it is found that it's even higher proportions among people with IBS. Other foods that may contain lactose and should be avoided are butter, buttermilk, and whey. If you decide to follow a milk-free diet, make sure that your new diet meets your daily protein requirements by adding lentils and seeds to your diet. Especially linseeds are good for IBS. Go for milk alternatives such as nut or hemp milks that are fortified with vitamin D, calcium, and B12, and some are also fortified with iodine. These are great, as well as cheese alternatives made from nuts rather than other fats. Now, the next step is to avoid gas-producing foods. Foods that increase intestinal gas and flatulence include alcohol, coffee, all foods from refined grains, beans, Brussels sprouts, raw carrots, raw onions, garlic, wheat germ, cabbage, and high-fat foods. Gradually eliminate a caffeine intake to avoid any withdrawal symptoms. Also, foods containing sorbitol, xylitol, and mannitol found in sugar-free chewing gums and some processed foods and drinks are best avoided. You also want to eliminate fructose-rich foods. Similar to lactose intolerance, fructose intolerance does exist, and it happens when cells of the intestine aren't able to break down fructose efficiently. Studies show that 1/3 of patients with IBS have also fructose intolerance, and their symptoms improved on a fructose restricted diet, and by contrast, non-compliance with a fructose restricted diet was associated with persistent IBS symptoms. Foods that contain high levels of fructose to eliminate from your diet include sodas, some energy cereal bars, watermelon, apple juice and pear juice, and apple cider, as well as foods containing high fructose corn syrup or other fructose sweeteners, namely sugar alcohols, fructooligosaccharides, FOS, corn syrup, sorbitol, agave nectar, and of course fructose itself. You also want to go and eliminate gluten. Although the role of gluten restriction for people with IBS who are non-celiac is controversial, dietary restriction of gluten might be very effective for decreasing IBS symptoms in some people because of existing gut dysfunction and an impaired gut barrier. Now, gluten-rich foods include beers, breads, bulgur wheat, cakes, pies, candies, most cakes and cereals, and crackers. You also want to take probiotic supplements by balancing out your gut bacteria. Probiotics are believed to improve IBS symptoms. Clinical studies have found that probiotics like Bifidobacterium and Lactobacillus acidophilus are some of the best live microorganism cultures for treating IBS and related symptoms. These probiotic strains have been observed to minimize poor gut motility, loose stools, and abdominal discomfort. Probiotics may also promote bowel regularity. I recommend taking probiotics as a supplement on an empty stomach because there is less residual stomach acid on an empty stomach. In the case of IBS, I also recommend avoiding probiotic-rich foods such as kombucha, kimchi, miso, and sauerkraut because of their gas-producing potential. Probiotics should have no less than 100 billion colony-forming units and 10 different bacterial strains to be the most effective. Also, you want to consume smaller food portions. Consume food in smaller portions more times a day by following a regular meal pattern and avoidance of very large meals. You will see major improvement in IBS symptoms. Also, curcumin. It is a member of the ginger family that is derived from turmeric, and curcumin has anti-inflammatory activity, and it has been shown to decrease abdominal pain and improve quality of life in people with IBS. The recommended dose is about 100 milligrams daily for 2 months. Also, fennel seeds have a relaxant effect on the intestinal smooth muscle, so they reduce abdominal cramping and pain. And you can take fennel seeds as an essential oil by adding the oil to a small amount of water and drinking it regularly, or by adding crushed or raw toasted fennel seeds to your foods. Avoid this when you're pregnant or lactating. So to summarize and to finish off, by avoiding any triggering foods mentioned here and transitioning to a more nutritious diet and taking the supplements that I recommended, especially curcumin, people with IBS may avoid taking medication while drastically improving symptoms and managing the disease. Ultimately, diet and lifestyle modifications not only lessen inflammatory bowel syndrome symptoms, but also may lead to a better health and well-being in the long run. So I hope this video was beneficial for you, and I hope you liked it. If you did, please give it a thumbs up. Please also subscribe to my channel to receive information on many different health disorders and how you can treat them naturally. And also, please visit my website, thegorilladiet.com, for anything to help you move your health and wellness to a better place for you. Thank you very much for joining.